Technology is amazing. They can take lasers to your eyes and give you vision.
Hello everyone, my name is Dr. Dylan Callier. I'm a physical therapist and welcome to the New Medical Nomads podcast, where I get to document my journey as a medical traveler, as well as interview other experts within the traveling field. Now, the rules for the traveling game are constantly changing, so anything you hear on this show should be for entertainment purposes only. This is not legal, financial, or medical advice. Enjoy the show and safe travels.
Hello everyone and welcome to another episode of the New Medical Nomads podcast. I am your host, Dr. Dylan Callier, a soon-to-be traveling physical therapist. I got less than a month to go. I am super excited to get started. And today I am feeling great and also under the weather. If you can't tell by the title of the podcast, I got Lasik today. And I reached out to my group and there was some interest in learning a little bit more about it. And so I figured, hey, I'll just do a podcast on it. I will talk about it. You guys can see me. I got these fancy goggles on, taped to my face, and just give you guys my experience. This is something, man, technology is amazing. They can take lasers to your eyes and give you vision that I've never had before. I've had glasses since about the second grade. And I like to tell my patients that I peaked right about in kindergarten. So in kindergarten, I was like the fastest kid. I was popular. Everybody wanted to be my friend. And then second grade hit and I got these glasses. And then fourth grade hit and I got these braces. And really from second grade on, I've just been all out nerd from there. But here I am today talking about laser eye surgery with you guys. So LASIK has been something I've been wanting to do for some time now, ever since my last year in high school. But I was told to wait until after college, and then it got pushed off until after graduate school. Basically, I've been told that the more reading you do, the more computer use you have, your eye vision kind of gets worse. And so that's why they want you to wait till after school. But I've also heard that's not necessarily true. So I guess it just depends on who you're talking to, who the surgeon's going to be. But if you are interested in LASIK, I'm just going to be talking about my experience here. I am going to save the actual surgical experience until the very last. That way you can get the most informative parts. And then if you are considering it or on the fence, I would just suggest not listen to me when it comes to the part of the actual surgical experience. And also don't YouTube it before you go in. The reason I wanted to get LASIK done now versus in a few months, in a couple of years, anything like that, is I actually wanted to have it done before I left for my first assignment for travels. And if you have glasses or have had contacts, you know the difficulties of traveling with either glasses or contacts. If you're going by air, contact solution just leaks out all over the place. Even if you use a Ziploc bag, it kind of just goes everywhere. Your contacts end up getting all dried and hard and not usable. And so that makes it a bummer for your trip. And then if you're going outside the country and you're taking your glasses with you, you're like, oh man, what if I lose my glasses or if I lose my contacts? And then you bring your second pair of glasses and you're so nervous about losing the glasses, scratching them up. Definitely kind of impairs your experience when you're visiting somewhere new. Same thing for going to work. If you're going throughout the day and all of a sudden contact pops out, did you bring your glasses with you just in case? No, I didn't. So now you're going throughout the day with one contact in and you're getting headaches and you're still trying to be this happy-go-lucky guy and gal talking to your patients. So it is really just a hassle. And so I wanted to do this before I did my traveling experiences with medical travel. So I made this decision maybe 2 to 3 weeks ago. It was a fairly quick turnaround, made the decision, contacted my friend's brother who told me of a surgeon that he would highly recommend. So I went to go see him, scheduled with him. went in, they take your measurements, do all the normal eye stuff. They walk you through the procedures, make sure that your eye history is healthy, that you yourself are healthy, go through all the checklists that would exclude you from the surgical procedure, and then kind of just give you the rundown of what's going to happen. And so from that day, I was actually able to schedule it a week from that original consultation. So that was a very quick turnaround. I was actually not expecting that at all. And then the good thing as well with LASIK is that the healing process is so quick. So today I'm supposed to be taking it easy, not doing anything, nothing planned, but I'm a bad patient, so I'm doing a podcast instead. But it's relatively low activity on the vision. The healing process for after LASIK versus PRK, which I'll be able to go into minimally. Again, this is not my scope. I'm not an eye dude, but just sharing my experience and what they told me. LASIK, you're usually down for around 12 to 48 hours. And then after that, you're good to go. So relatively quick recovery time. I was able to take off today, and then I will be back to work tomorrow. So that was definitely a plus to where I didn't have to take an entire week off like you would for the PRK. What is the PRK? So I'll kind of talk about what they told me with LASIK, and then I will talk about with PRK. With LASIK, they go in with a laser, and they cut a flap for the cornea to flip backwards. And then they're able to use all the lasers and such and instruments in order to fix your vision from there. With PRK, they actually remove the entire layer of cornea, pop it off, do the surgery, put it back on, and then I assume the proteins allow it to just heal back on. So with LASIK, again, it's around 12 to 48 hours that you can, not wear this awesome protective gear and go about your business. With PRK, though, it's about 5 days. So PRK does have a lengthier healing time, but I've also been told it's more direct and gives better results. That part I'm not sure about. That's just what I've heard. But I do know that PRK gives you a longer healing time versus LASIK. And so I went with LASIK. That's what the option I was given. And basically, when I went in that first day, they were looking for any type of abnormal pressures in the eye, like your glaucomas, things like that. They were also looking at if I had any scarring, which I did, unfortunately, have some scarring in my eyes. But they were very minimal, and so they were able to do the procedure without delaying it. Something in the contract that I did notice is if they were to come up with the decision that my scars were too thick for the lasers to work, then they were going to make the decision to go ahead and do the PRK right then and there. So talk with your surgeon, make sure that you have enough time to take off for 5 days just in case. That's what I found out. But I was told like 1% chance that was going to be an issue, and it wasn't. So I will be back to work tomorrow. They also, on the way out, give you, or don't give you, you have to go and get your prescription of some eye drops. One being antibiotics, one being steroid, and then they also give you some artificial tears as well. And so I'm going to be using those about every 2 hours. Just kind of, again, taking it easy each day, trying not to go outside, staying away from dusty environments, and protecting my eyes. So no playing with the dog, no doing any type of sports or lifting activities for about a week. And then the vision should be full force tomorrow, just with a little more irritation. They said I might have some blood vessels popped in the eye, which I do. That'll go away. That's part of it. Feeling like there's something in your eye and you have to rub it. That's part of it. The itchiness, the dryness, the burning. Basically kind of like watching, if you wear contacts, if you ever go to a movie theater and watch a movie or play like several hours of video games, you get this burning in your eyes. It's not very intense. It's just kind of there. And that's kind of what to expect as well. And then I also had to schedule a follow-up appointment. So I'll be seeing my normal eye doctor here 2 or 3 times in this upcoming week. But also other things to expect. There is some glaring, so lights are very bright. Does give you kind of a headache sometimes. I'm actually gonna put my sunglasses on here in a little bit because it was pretty bright in this room. And that's pretty much it for it. It's really amazing how fast of a process this is to just, go in. And let me tell you, I was blind. I am a blind person. um, if I was to have to drive before without glasses, I might be able to make out a stop sign just by the shape and the color. It's that bad. No reading street signs, seeing other vehicles moving. I've had to do it before and it was absolutely terrifying coming back for 40 minutes, 45-minute drive on the interstate. Oh gosh, that was bad. Never again. Uh, and that was basically a quick story. When I was in mixed martial arts, I would train and I would travel down south to another bigger town to where I could train boxing. And on this boxing day, there was this, the instructor was what I'll call a grandpa. And so he would bring his grandkids in. He was just one of this, you think of the old man in Rocky, just kind of crazy, hardcore dude. And he would, take people and make them take a wheelbarrow and wheel up this big old hill and cut down trees with the axe and then put it in the wheelbarrow and wheel back down. Not because he needed wood, but just to do it for the exercise. And so he would come in and there would be guys twice his size. And this old guy would just whoop up on all the young dudes there. We also had one chick. And he would just, his endurance and his power is just amazing. And it was just, not only did you lose the match, you also lost a little bit of dignity because he's 3 times your age at the time. But when I was sparring that day, they didn't have, because it was such a small class, they didn't have any weight classes. So you just kind of sparred up with everybody. And this one in particular, man, was about 6'4", 240 pounds, just solid dude. Not fat, just a muscular big man. And we were sparring, and I was trying to work my way in and out. And it just so happened that he threw a jab at the right time with all of his weight through it and just clocked me hard. And so I kind of went down on the ground, and it hit me so hard that my contacts actually ended up popping out. One popped out, one kind of, it was just kind of where he hit me in the eyes. And so both of my contacts are on the sweaty gym floor, and there's no way those are going back in my eyes. And so now I have this 40 to 45-minute drive back home. And so luckily I'd done this enough that I knew the route, but it was slow. If I would have been, it was a slow go, and it was very terrifying. And ever since then, I've always kept a spare pair of glasses inside my vehicle. But that was just a little tangent there, a little story about some of the unexpected and things that just kind of happen when you have glasses or have contacts. All right, guys. So wrapping up here, this is going to be a really short podcast, really just for those interested in getting their eyes enhanced from the bad vision, from their previous vision. And I think it's a financially smart decision. I spend anywhere between $350 to $500 on contacts per year. Glasses aren't cheap either. And I've been told the normal price range is around $2,000 per eye, which is true in my case as well. I've heard you can get it cheaper as well with students performing the procedure, but I was not comfortable with that. So I went with the surgeon who was quoted to me as the Lasik whisperer in St. Louis. But if you are interested in LASIK and you haven't got it yet, that's basically all you need to know. Definitely, I'm not an expert on this. Call your surgeon that you want to work with, or ask your personal eye doctor, your primary eye doctor, and get checked out that way and make sure that it's right for you. But it was a really good option for me. I'm already seeing better. I was seeing better when I was walking out of a room after the surgery, and it just continually to continually progresses as the day goes on. So I'm already really happy with it. I can't wait to take these things off my face and be able to actually see what it's going to look like. But I'm super excited. But I'm going to give it about 5 seconds, and then I will go through the actual surgical experience. Again, if you are thinking about this, thinking about going through the surgery, do not listen to this part. Just go with it, and then I'll kind of go into it. Okay, so the actual surgical experience. You walk in, it's super early in the morning, and you go back and they ask you if you're anxious at all, how are you feeling, do you have any questions? And so you're going through everything. They're going through all these big med lists, and kind of like a normal hospital procedure. They just throw so much at you, and there's no way you're going to remember all that. So they give you, some paper. It's all written out, which is fantastic, especially after an eye surgery later that day. But actually, it's been a wonderful process. But they do ask you if you want any type of relaxers before you go into the room. And if you are a bad listener and you're listening to this and you're still thinking about LASIK, if you have any type of anxiety about it, I would just go ahead and take those medications. I did not, but let me tell you, that is an intense surgery. That oh my gosh, that was much worse. That was, I don't want to say worse. That surgery was much more intense than I was anticipating. My mother had gotten it. I know people who have gone through it, and wow, that was a big one. You go back into the room. It's like a typical surgical room. Everything's clean. You don't have to gown up or anything. So you just walk in and then you lay down. And they put these like sensors in, or the big machines over your face that kind of go back and forth. And so one machine will do one eye, one machine will do the other eye. And before you start, they start putting numbing drops into your eyes so that everything is fine. They do this 3 or 4 times, and then they tell you to go to this machine, and you're looking at it, and there's like this circle that you're supposed to stare at. And well, as that's happening, they put these instruments, they call them instruments, into your eye, basically to force your eyelids to stay open. And it's not very gentle either. It's quite a bit of pressure that they put on it. And then they tell you to stare at this circle. And as you're staring, I was actually able to see a little bit of the reflection, but then they start using the laser to make the cut. And so as they're cutting, you hear it, and it sounds like you're at a dentist. So it's this high-pitched whir, like, and as it's going, you also start smelling some like burning tissue. So that was unexpected. After they make the cut, I was actually able to see the reflection, and so I actually saw him, the surgeon, take my eye flap and flap it over. That wasn't necessarily bad, and actually that eye went pretty well. Then after that, it's only about 11 to 15 seconds, and they do the laser part. You hear some clicking, and then it's over. And then they put the flap back over. They paint some stuff on your eye. You can't feel anything at the moment, but you do like see things coming at your eye, which is super strange, super weird, and kind of terrifying. But all in all, it was very, very good. But going to the left eye, for whatever reason, was so much more intense. It was like all the pressure graduate school just in my left eye. And they put the machine in there, the little instrument, and they crank it open. And as you're staring at this light, or as you're staring at this circle, there is a brief moment where you just lose vision. And they just keep telling you to face forward or to stare forward. So they keep telling you to stare at where you think the circle would be, but you can't see the circle. So you're just blindly hoping that you are staring at the correct position. And usually he did a really good job of saying, yeah, you're doing great, blah, blah, blah. Keep it up, working great. And then as they're doing the second eye again, you see the laser, or you don't see the laser, you hear the laser, and then you start smelling the effects of the laser. And after another 10 seconds, it's all done. They paint your eyeball a little bit, and then you sit up. And they tape these protective covers on it, tell you that you're going to be sensitive to light for a couple of weeks, and that's about it. So the surgery is very short, not even 40 minutes long for me. I've been told it can go up to an hour, at least for LASIK. But during those, not even a minute of the instrument in your eye and the machine on your eye, the pressure is very intense. The senses were very intense, and that was a higher part of the surgery than I was anticipating. So my advice, if you were a bad listener listening to this, go ahead. If you are anxious at all, just take the medication. I didn't want to. I'm glad I didn't, because I've never taken many medications anyhow, and that's just another complication if you end up being allergic or if you end up having a side effect, anything like that. I'm sure it was a low dose, but I was able to handle it on my own volition. But yeah, if you have any questions on LASIK or anything like that, at least from my experience, you can reach out to me. I'd be happy to answer anything. But again, the best people to ask are going to be your eye doctors, your primary care, or your eye surgeon if you do reach out for the surgery. But if you are looking for the next episodes for the New Medical Nomads podcast, you can find that on the New Medical Nomads podcast page on Facebook. That's where I officially launched them. Also, if you want early access to the episodes, you can find us on YouTube. That's where I usually upload them about a week or two in advance, and you can get the early episode editions there. But whatever you're listening to the podcast on, iTunes, Stitcher, YouTube, like, comment, and share. Show the podcast some love. That I would greatly appreciate that, getting the message out to the people I'm trying to reach. And I hope that this brought you guys who are interested in LASIK or just wanting to learn more about it some value, and just me talking about my experience. But if there's any more updates, I'll be sure to add these to the episode before I upload them. But I don't imagine anything is going to happen with the recovery process that I don't know already. So thank you so much, guys, for watching. I greatly appreciate it, and you all have safe travels.